just moments ago, 161 Australians touched down from London in Darwin as part of a series of flights that the government has been organising to support other changes in cap arrangements, which is steadily and surely ensuring that more and more Australians are getting home. And I'll come back to that in reporting on the outcomes of National Cabinet. And of course, the Acting Chief Medical Officer, Paul Kelly, will report on the usual matters. At National Cabinet today, we agreed in principle, given that we had a number of jurisdictions today who are in caretaker arrangements, that constrains a bit of what they can do at each meeting. Even here in the ACT, while the outcome there was fairly clear, they are still not finalised in those arrangements, so technically in the ACT they were still in caretaker. But we agreed in principle, again with the exception of Western Australia, and their reservations were outlined on a previous occasion, with the reopening framework for Australia by Christmas, and this is the plan, and it sets it out. It'll be very familiar, I think, to many, the reopening plan to get Australia open by Christmas of this year. Importantly, this plan not only details the opening of the various activities within our economy and within our community and society. An important part of this plan is that it includes the necessary actions that are needed on a public health response to support that plan. And the work that Alan Finkel has been doing, in particular the work that has been done on hotel quarantine and improvements in all of those areas, are vital and essential to the achievement of that goal. By the end of this year, Premiers and Chief Ministers reiterated their support for that goal today, and we have made further progress, and that will come back again to National Cabinet when it next meets on the 13th of November. And indeed, where things can be progressed before that, they will be. But over that time, we will also have further actions coming from the Finkel work that is being done around tracing mechanisms around the country, as I'd indicated after our last meeting. We also agreed the recommendations of the hotel quarantine review that was undertaken by Jane Holton, and that report will be released after this media conference. It was also agreed to develop a risk stratification approach, as it is known, to international arrivals and their quarantining arrangements. Now, one of the great challenges, as we discussed today, particularly early on in the pandemic, was there were many things that had to be done extremely quickly to respond. And what we want to be is in a position as we go forward, and when we're in a position to make decisions down the track, not today, but down the track, when it comes to other types of international arrivals that may be able to come to Australia again, when we're in a position where we can reopen some of those arrangements, particularly in relation to things like international students and migration, these types of things, then we want to be sure that we've worked the options well, we've trialled and tested them, so we can give Australians great confidence that when we're in a position to do that, we have worked through those. So whether that's quarantining in-home, on-farm, in camp, at a mining camp, on campus, any of these options we'll be looking at and working together with states and territories to both identify and trial some of these options, so when we're in a position to make further decisions on arrivals to Australia, then they will be well worked through and we can have a great degree of confidence about their implementation when that occurs. We agreed to increase caps again for a number of jurisdictions, which will further assist Australians coming back from overseas, an additional 140 next month in Western Australia, another 150 in Queensland. But we've also got continued support out of South Australia, the ACT. We have the arrangement in Northern Territory that I announced last week. Tasmania stands ready to assist, I want to be very clear, but as they don't yet have an international airport and those systems in place, if we needed to stand that up in order to achieve what we've set out, then we will certainly do that. They are our further standby option, and I want to thank Premier Gutman for his working together with us to achieve that. It would be on very similar arrangements to what we've done in the Northern Territory. But of course we're continuing our work together, Premier Gutman and I, as part of the Hobart City deal, to stand up the international airport in Hobart, and we'll be having further discussions on that in the weeks ahead. All jurisdictions, though, have offered their support, particularly to provide flexibility around caps to enable us to get the most vulnerable of the Australians home. Now, I can confirm when we made our commitment on the 18th of September, there were registered some 26,200 Australians. 4,100 of those were vulnerable. So far, 1,278 of that vulnerable cohort have come home. That doesn't include those who have just arrived in Darwin, and 4,591 have otherwise returned out of that cohort of 26,200. So we continue to make good progress towards returning Australians home, and we want to do that as effectively and quickly as safely as possible, and we will continue to work with all state and territory jurisdictions to facilitate that wherever we can, and I thank them for their cooperation to date.